Which type of cell health factor seen in final pair of children is type 3C? The 93 answer is type C. A final plate factor is type C type 3. 94. PRF and Doppler PRF and Doppler affects a velocity. PRF and Doppler affects velocity. And LE is reduced by grade compression. LE is reduced by grade compression. Aliasing is decreased by increasing PRF, increasing angle of ionization, and decreased pulse frequency. So memorize this. Aliasing decreased by increased PRF, increased angle of ionization, decreased pulse frequency. Then whichever option is written out of these will be the answer. Isaac, most common location of carotid tumor is the small intestine. Helium is 91% involved in your carotid tumor. Most common location of carotid tumor is small intestine. 7. String of Pearl signs seen in aerodynamic ileus. String of Pearl signs seen in aerodynamic ileus. Read this. 98. AVN of lunar is called Kienbock disease. The fibroid disease, head of second metatarsal, AVN. Kienbock disease, lunate. Collar disease, patella or navicular bone. Camel disease, vertebral body, like Porter's disease or femoral head. Panner disease, capital of humerus. And Piezer disease is capoid. And then for regular cup entry, MRI general level of acromioclavicular joint. For regular cup entry, MRI general level of acromioclavicular joint. Supraspinatus is common, so MRI general level of acromioclavicular joint. And rotary cup entry, most common injury is supraspinous tendon. 100. Young girl has had nodule of distal radius which seems to be ABC. Which investigation is best at this age? The MRI to see the fluid level. 101. Young boy having a blow on vertex will have C1 is involved in Chapman factor. C2 is involved in Hangman factor. 102. Penile parachute reaction shows E none of the above. Penile is soap opera appearance. The other parachute reactions. 1 of the most common primary tumor causing brain mets is pancreatic carcinoma or lung cancer. 104. Short stature, 12-year-old female with short forehead metacarpal seen in Turner syndrome. Short forehead metacarpal seen in Turner syndrome. Now, patient following trauma following unstable flexion injury is flexion teardrop injury C. 2. Patient with pulsatile tenderness, abdominal deep eardrum orthoscopy or mass lesion seen as into the cochlear pulmonary on CT. Diagnosis glomus tympanicum T. 3. Female having mediastinal pneumonopathy, well-defined nodules and subpleural located along bronchoscopy bundle. The more marked in the upper mid zone is A. sarcoidosis. Mediastinal pneumonopathy, then well-defined nodules and subpleural located along bronchoscopy bundle, and then more marked in the upper mid zone is sarcoidosis. Now, in ultrasound, hip considered abnormal when beta angle greater than 77. 5. An elderly male with focal activity in right female shaft is focal Packett's disease. 6. Multiple myeloma, most appropriate statement is generalized osteopenia C. 7. Supraspinatus involved rotary impairment syndrome due to position below acromion. Supraspinatus involved in rotary impairment syndrome is due to position below acromion. 8. Patient with history of gallstone, dilated bowel loop, gas and right hypochondrium, regular triad, diagnosis is gallstone ileus. Regular triad is gallstone, dilated bowel loop, and gas and right hypochondrium, diagnosis gallstone ileus. 9. Heterogeneous enhancing lesion in the thoracic spinal canal, peripherally causing cord expansion enhancement of the adjacent meninges, known as astrocytoma. Inside thoracic spine is astrocytoma, causes cord expansion. The posterior vertebral scalloping is mnemonic is Salmon, SALMON, and cord expansion is seen by astrocytoma and ependymoma. But astrocytoma occurs in children, it is heterogeneous and seen in the thoracic spine. And ependymoma is seen in adults, it is homogeneous and is seen in the cervical spine. Now, Salmon mnemonic, posterior vertebral body scalloping. H for spinal cord tumors, astrocytoma, ependymoma, schwannoma. A for achondroplasia and acromegaly. L for Dewey-Dietz syndrome. M for Marfan syndrome, mucopolysaccharides. O for osteogenesis imperfecta, and N for NF1, neurogrammatos F1. Unknown author, okay. 1. Rapidly growing nodule in Hashimoto's thyroid is neoplastic. 2. MR fluid reversible infrared MR perfusion. 3. Fallen fragments sign seen in simple bone cysts. 4. In alcoholic cirrhosis, ascites worsens the prognosis. Question number 5. Chronic pancreatitis is not associated with increase in intra-abdominal fat. Number 6. Hydranencephaly is cerebral agents with dilated ventricles. 7. Intraventricular hemangioma common site is trigona of the ventricle or atria of the lateral ventricle. 8. Nasal mass in 14-year-old boy with epistaxis is angiofibroma. 9. Cruzen syndrome may have trigonocephaly. Cruzen syndrome may have trigonocephaly. Trigonocephaly means triangular shaped. 10. Third, pancreatic cancer can arise in pancreatic head. 11. Caudate lobe arterial and venous supply. Caudate lobe arterial supplies both rise on hepatic artery, and caudate lobe venous supplies inferior vena cava. 12. 55-year-old with dysphagia having focal wall thickening with calcification. Leiomyoma. 13. Anterior compression on esophagus by aberrant left pulmonary artery. 14. Air bongogram not involved in a hematoma. Air bongogram is not involved in a hematoma. Also no air bongogram in cavitation. Significant factor in diagnosis of lung cancer is B. Effusion. Significant factor in diagnosis of lung cancer is B. Effusion. T2W appearance of MI with question is high signal short hemorrhagic. Okay. Pulmonary effusion, unilateral thickening and bilateral thickening. Okay. Step layer pattern of spinal seen in rheumatoid arthritis. 18. Pure lung deformity causes are Turner syndrome, in that there is distal radiate tears and ulnar deviated. So pure lung deformity causes is Turner syndrome. 19. Bilateral present breast masses with microcavity is a cirrhotic adenosis. 20. Most common type of breast cancer is B. Carcinoma in situ. TCI is ductal carcinoma in situ, so carcinoma in situ. So 21. Invasive ductal carcinoma easily missed from mammography. Invasive ductal carcinoma easily missed from mammography. 22. Joint effusion, epiphyseal widening, patellar femur narrowing, articular erosion. Diagnosis is hemophilia. Now, epiphyseal widening, joint effusion, and patellar femur narrowing, articular erosion diagnosis is hemophilia. 23. Subdural hematoma etiology is rupture of breathing veins. Subdural hematoma etiology is rupture of breathing veins. Rheumatoid arthritis shows pleural effusion unilateral and pleural thickening is bilateral in rheumatoid arthritis. Question number 24. Associated tubular pathology than glomerular is a penicetin. It is causes analgesic nephropathy. This is penicetin. Question number 25. Metal kidney not always bilateral. It is unilateral. 26. Hepatic laceration 2 cm long, 8 cm deep, grade 2. Question multicyst plastic kidney is B. No pyelogram because it is non-functional kidney. 28. Ischemic colitis is long-term side effect is obstruction. Ischemic colitis shows loss of hydration and long-term side effect is obstruction. 29. ACL tear associated with B. MCL tear. It is called unhappy is ACL tear, medial lemniscus and MCL tear. So ACL tear associated with MCL tear. 30. PID affects a uterosacral ligament. Fixed organs of pelvis, pelvic inflammatory disease affect uterosacral ligament. 32. A young patient with dyspnea, small aortic knuckle and large pulmonary artery, ASD. Small aortic knuckle because decreased pressure in aortic knuckle due to septum. So young patient with dyspnea, small aortic knuckle and large pulmonary artery is atrial septal defect. 32. A young child with cyanosis, small pulmonary artery, oligamy with auditory tract obstruction and various effect is tetralogy of Fallot. 33. High speed RTS sudden chest pain radiating through back. You will see wide mediastinum. 34. Expansile pneumonia seen in Klebsiella. 35. Gastric cancer layer 2 pernicious anemia. 36. Gastric cancer penetrates posterior wall to involve pancreas or lesser sac. 37. Blunt trauma abdomen most common injury is duodenum. Pancreas answer that's most common, but other is duodenum. Plant adrenal area most common injured is duodenum. 38. Oncogenic rickets associated with fibroxanthoma. Oncogenic rickets associated with fibroxanthoma. The nine sunburst match like osteosarcoma seen in A rectum. Sunburst match like osteosarcoma seen in A rectum. Rectal. 40. Unlikely hypertension of T1W is 14 dependent period. 41. Recurrent salivary gland imaging. Facial nerve divides parotid gland into superior and deep lobe. HIV rare you forget this. 43. Multiple less than 1 centimeter pulmonary nodules in a subpulmonary concerned metastasis. 44. Pulmonary TB isolated period could only be the only presentation. 45. Short metastatic causes are dystrophic pseudohypoparathyroidism, decreased PTH, DTPA, trisomy 21, Turner, and Alpine syndrome. 45. All pancreas tumors should be divided by MRI in the absence of bone erosion. 47. Non-mobile vascular mass in UV of female with hematuria primary. Its cause is primary malignancy. 48. Which one is true? B. Malignancy is always hyperacute. Which one is true? Malignancy is always hyperacute. 49. Dribbling may also be present in duplex system. Dribbling may also be present in duplex system. 50. Medial deviation of ureter is not caused by source hypertrophy. Medial deviation of ureter is not caused by source hypertrophy. Which one less than 1 centimeter mass of adrenal can be seen on CT. Less than 1 centimeter mass on